Greetings, everyone. I am Deidre, also known as Yafe. Welcome to True Health Live. As you come into the room, today is about really asking questions. Well, it's always about asking questions. If you have any things that you want to hear about, and we'll do another show. I always talk about at the end. But it's always an open discussion. As public health is an open topic. There's so many different things that we can get into. But today we're going to talk about, I'm going to talk with you about community. So the truth. What's the title? The truth about community and public health. And so what that means is, or what was in my head when I was thinking of the title was, okay, well, what does it look like when a community has been successful at a public health initiative? Or, what does it look like when a public health initiative is successful, by some measure within the community? And usually in public health, that measure is, done through research and evaluation. If we implement something, we, then evaluate what the outcomes are. How did it operate? Peace, Naya, welcome. We evaluate what that looks like, and it gives us our measure of success, right? So getting into community and public health. And please share what your thoughts are on community. I think we're live on 3 different channels. So as you type in your messages, I should be able to see all of them. I'm going to make sure I'm linked in to LinkedIn so that I can see the messages. But I wanted to start with very basic definition of community, and also feel free to share and put those in as well. Don't look it up because I already did, and I'll get that. What are your thoughts on community? What do you think community is, or what comes to mind when you think community? Or you can even share your thoughts of the ideal community, right? So as you're pouring those in, community, according to Oxford, community is, and most things, not most, but as we know, many words in the English language stem from the Germanic languages or Latin, right? In some way, shape, or form. And commune, commune, it means together, gathering. So in the simplest sense of the word, community is a group of people who live in the same area, geographically, live in the same area, or they share a particular characteristic, right? And the characteristic could be demographic, it could be ethnicity, it could be race. So but they live, together. Or they are practicing, they have common practices, and they have that in common. So that could be culture, all right? It's religion, how we eat, how we work, how we play. So that's also community. Another definition, in addition to people that live in the same area, and I'm giving this because you can live in the same area, and not necessarily share the culture of your community members, right? Or the people that live around you. And so then you have to think, well, is it a real community? So I want us to start really digging into what the word community means, and are we, actually living that and moving within that word to the fullest as we think about how public health initiatives work in community. So as I was saying, the other definition is feel that feeling of fellowship, or people who fellowship with one another, and it results in common attitudes, intents, or goals. So in my mind, that's a better definition of community. So when we think about when we live in an apartment building, I've lived in 2 apartment buildings, and I can honestly say I didn't necessarily know my neighbors, not to even the point where I can go borrow a cup of sugar, anything. If I met any of them, it would be because the power went out, because there was a storm and everybody's out looking bewildered. Is your power on? Is your power on? Or something happened, that affected us collectively. But did we necessarily know each other or share anything? No. And I would say the same thing for the second building that I live in. I think I really, truly had the longest conversation with my nearest neighbor on the day that I moved out. She was very nice lady, very nice lady. We would see each other from time to time, but I didn't know her from, as they say, a can of spray paint, and she did not know me from a can of spray paint. Welcome, Naya. Welcome, Akuya Bisa. Peace, peace. Peace, Master Menelik. Peace, everyone. Thank you for showing up. Thank you for being here. So yes, I can honestly say I didn't know her. So then it's like, well, do we really have community? And so again, then it just becomes community when we have something that has affected us, whether positively or negatively, in some way, some shared experience. Yet again, do we have okay. Yet again, do we have those shared intents or attitudes or goals, right? We may be in the same space, but we didn't necessarily share any sort of culture or commonality aside from living in the same area. So I think it's important, when we think about communities, and we have so many different communities across the country, across the globe, right? And we think community health centers, like these are places that are serving people who are living in an area and they do share something, maybe it's a chronic illness, maybe it's an unmet need. So, you'll have initiatives that serve the community to, help to address unmet needs or help address health disparities, because that's something common that they share. Yet sometimes there's always that missing, there may be, I shouldn't say always, there may be that missing link where we're not necessarily knowing, really truly knowing our neighbors. Those neighborhoods, it's almost like a bygone era, right? And that part I can say because I am of a certain age. But you don't necessarily know your neighbors anymore. I remember growing up, I knew the next door neighbors and the grandmother down the street, and they knew my parents, and it was a whole different way. And now, not necessarily so much in the same way that it was then. So yeah, so those are the definitions of community. Either like you live in the same place and you share common practices, or maybe you share common characteristics, but these things are not guaranteed. Or it can be people who are sharing a particular attitudes, intents, and goals. They fellowship with one another, quite like Anu, right? So that also a community in that form. You don't necessarily need to even be in the same physical space. It's great when you are, but if it's about attitudes, intents, and feelings, not feelings, attitudes, intents, and goals, then you not necessarily need to be in the same space. Think about, even on here, like on LinkedIn, on one of these all these platforms, there's community groups. There's, groups and clubs that people start. And this is because there is a commonality about goals, intents, and attitudes. So sometimes, this is how you have people who start like whole relationships, whether romantically or not, but whole relationships with people online because there's some sort of shared commonality. And they might have closer relationships with people that are physically closest to them. So that physical and geographic area doesn't always have the fullest view of community. But anyway, what makes it work? Because, when we talk about public health initiatives, that is really talking about that physical and geographical area and how people share communities. And, so we've gone over the meaning of community and what we're talking about. And so I want to talk about how we get to that avenue of public health. We discussed a little bit about community health centers, like, what they are and what they do. But what is community health and what is public health and how do they intersect, right? So that idea of community health is really about like the collective well-being of the people who live in that physical geographical area in that space. Remember, as I said, like maybe the intent is to address a pervasive chronic illness. We talk a lot about social determinants of health, and this is really where they start. I mean, truly, they start in the home, but your home is located in your community, right? Or that geographical area where you live. So social determinants of health start there. It really is, the genesis of social determinants of health. And that community health piece can also be seen as almost grassroots, right? Like that grassroots application or addressing of health concerns and health disparities, right? And then how it fits into public health, which is, where I came from, is, an example of that is really thinking about, okay, like, well, what kind of funding can we give to this particular neighborhood or this community center or this organization that services this particular community to see if we can address maternal and child health. We know that a big issue in this country is the maternal health, especially amongst Black women, African American women, and women of color, and the mortality and morbidity rates of babies and mothers, in that realm. And so a lot of work has been put forth in bringing that to light. So part of that is like, well, let's put money to that, and we will raise awareness, increase education. There's a push toward, we need to have more physicians and doctors that look like the people that they're serving, so that there is a relation to having they have a relation to a lived experience or a shared experience that they may have. You look like me, so maybe there's something that we can communicate and connect on that I may not be able to connect on, that someone who does not look like me can do or understand, right? So that's one way in how we can connect those avenues, or from public health to community health and vice versa, right? And again, as I said, how do we know it works? So then we look at like what the outcomes are. Do we have an increase of a decrease? It should be. Do we have a decrease in morbidity rates? Are we having less women and less babies dying? That would mean there was some success. But it just doesn't come from throwing money at it, right? There has to be, and money does help, don't get me wrong. So I don't want any of the nonprofits to come after me. Throw money at it. At the same time, there has to be a plan on using it, so how do we educate the community members, who are going to be the recipients of this funding? What does that program look like? Does it include education? And then when we do that, how do we engage them? Is there some meaningful way that we are providing the products or services where the community does feel empowered and they feel like they are part of the decision making? Or is it just more people who have no connection to the community, have not really researched the characteristics of that community and the people that live there, and providing a service? So those are the different ways in which we have to think about, like, how we connect the public health to the community health. And also, I gave you some ways in how it works. Like, we know that if we educate, then we engage in a meaningful way where it's relevant, and the people who are providing the education and the services, look like and can relate to the people in the community, whether it be because, and it doesn't always have to be look like, but if they came from the community, there's that common shared experience. They know what it's like to live in that community. They know what, experience they've had, and they may vary, but there's a shared commonality, right? That togetherness. So those are some ways that they're successful. And again, even if you don't necessarily come from that community, ways that it's successful or can be successful, how public health initiatives can be successful, is really looking at the characteristics of that community and learning about them, and not just like going in. So this going in and like, okay, we're going to provide this. And that really makes sense and key, especially if you're a public health student looking into working in community health. Really get to know the community that you're in. It's almost rude. Not even almost. It's rude. Coming in and with a savior complex, regardless of what you look like, because and I'll share a story after. But regardless of what you look like, you can look like the people in that community, but if you don't come from there, you don't necessarily have an idea, any idea of what it is to be there, grow up there, live there, and experience life, through that process, right? So if you come in and like, I got all these things and I want to help, but you never took any time to learn or involve people who come from that community in your process, then it doesn't work. And then it's just disrespectful. So the story that I was going to share, and this is an example of public health initiative moving into community, and it had its things. And for purposes of this, really being something that I actually was involved in and included organizations and agencies, I will not mention names. However, I did, one of the projects that I worked on was a film. We're making a documentary, and I'll get to the chat. We're making a documentary, and this documentary had, what I will do is talk about the information that was public. The documentary was, and the truth is, if you do a little digging, you can figure out who was who. But the documentary was about housing, right? So a few years ago, the United States Department of Housing and Urban Development, they mandated that public housing authorities go smoke free. And I've never lived in public housing, and I didn't necessarily have a lot of people who lived in public housing in my circle, and especially when we're talking about like the current, right? Because things change over time. So when we were talking about this documentary and thinking about, okay, well, what does this look like? There's certain things that's like, I want to do this and I want to do that. And this is me thinking, like, I want to do this and I want to do that. And, this is going to be a really difficult lift and I want to help them, And the idea is like, yeah, you'll help this, specific housing agency in this city. But what about the people who live there? What about the residents? And I want to say like, the residents, but the people who live there, how does this affect them? And you're making this documentary. So the best thing to do is like, well, maybe we should talk to the people that live there. And not only that, work with them, see what groups they have that would be interested in working with you in making this documentary, right? Because that's even a way if we can like provide some sort of give back. And in the community that I'm in, and I know we always talk about reciprocity, right? And reciprocity is not something where it's like, equal exchange and that whatever you give to me, I give it back to you in the same way. It's really like the exchange itself and like the energy behind it. It's never going to be exactly the same because now like all my essence is all over whatever you gave me and maybe I used it a little bit, so it's not going to be whatever it is, so it's not going to be given back to you in the same way, right? So, how can I make this, I was thinking, how can I make this a reciprocal exchange and really involve them? So this particular housing authority had a youth program. And so I was like, maybe there are youth who are interested in filmmaking. So we worked with one of their youth groups in an area in this city, and we really took them on and like had them work with like the contractors and the filmmakers we hired. They learned about like the boom mics, the best way to film on a phone and how to make a film. They actually conducted the interviews of all the hati tati executives that had to give commentary for this documentary, and they also gave commentary. They involved their families because they lived in this housing authority, or one of the campuses in this housing authority, because it was like a small city, the population in and of itself. And they were a part of that. And when we finished the project, it was really successful, right? The project, and I'm specifically saying the project, and it's still being used as an educational piece to this day, for people. I think they're still at this point, like working on evaluation to see how successful it is, right? Because, in order to, gauge like how successful, a certain implementation is, you have to kind of, ask some questions and see like how it's worked and how things have changed for people. So I want to point in specifically to this one part of a public health initiative. So the initiative was to have people go smoke free and not smoke in their homes. So one part of that education was making this documentary so people can learn more about like, well, what is it going to mean for me to go smoke free, and how do my neighbors and other people who live within this housing group think about it? Do they have the same thoughts as me? What are their fears? What are their opinions? So it was really important to do that and include. And another reason why I'm sharing this story is because I remember speaking with an elected official at the time. And again, I am not mentioning names. And I was explaining to this person, like, okay, what we were doing. And she looked at me and she asked, like, so do you live, or have you ever lived in, this place? And I looked at her and I said, no. And I said, and that's why we involved, it was really important for me to involve people who live here and hear from them how it, the best way to get this information out there. So, it really would behoove any community health worker or aspiring community health worker or public health student to learn the community, because even if you don't, it can come back to bite you. And that almost came back to bite me. So if I had gone with, the first mind was like, okay, well, I have this money to spend and I'm gonna throw it out. But I'm just going to make this and not even involve the people who it actually concerns. That would have been like, big mistake. And, even thinking back on it, hindsight, had I had more funding and more time, I would have involved more people, But again, it's really important to involve the people that are there, because it shows that there's a respect for what you're, not only what you're doing, because it's about like quality work. So not only are you respecting like what your profession and your craft is, there's a respect of the people that you claim that you want to help. So those are some of the things that make public health initiatives successful in communities, or communities successful in public health. So I'm going to go to the chat again. And if you're on LinkedIn, I'm going to try to get to LinkedIn to see, because I don't know. I don't think the comments are coming up here. Yeah, can't post to some destinations. So, Peace to Bisa, she says, another way to know if there are good outcomes of an implemented plan is to ask those in the community. Exactly. And you can do that through pre and post interventions or surveys. You know, what are some of the thoughts and feelings and stats and statistics, you know, what's happening now. Like, so if you're looking at, like, you know, the prevalence of diabetes, like, you know, so you take a litmus test of like what's happening. And then when the program, whatever your program is implemented, maybe it's like learning how to eat healthy. So you start from like identifying what healthy foods are, learning how to shop, and not even like learning how to shop, but also, do people have access to healthy foods? Do they have access to the places that give them healthy foods? Do they know like what nutrients and what things are in certain foods, so that they can shop, you know, in a way that is beneficial to them and their families, right? And then how they're preparing foods. And not only that, looking at the larger community, is it a food swamp? Are there more fast food and junk food establishments than there are places to get healthy food? Are people having the finances? You know, what's the economy like? Do people have the finances to afford the healthy foods? Because we know that fitness and health is a really big industry, and so the things in it, they're expensive. And so a lot of people are priced out. So it's more than just like, you know, we want to make sure that diabetes is reduced. Okay, well, there are a lot of things that need to be addressed. What's in the community? What things are available in the community? Do people have access? Do they know how to access them? Do they know where they are? And then, you know, how can we reduce the prevalence of pervasive, like, unhealthy food? So that's like all of that. And that's just like a few little examples of, you know, what has to happen. And then once you're done, and that kind of thing happens over time. So let's say, you know, once you're done, it's like, okay, what is the prevalence of diabetes now? And that's how you can see if, like, you know, things work. And, you know, you'll take different steps, and you'll take tests at different steps and stages of your process. Peace, see you, Kira Eden. Peace. I don't know what you were laughing at, Aquia. You just put it in the chat. I don't know. Maybe I said something. Master Menelik says, that level of ego reminds me of 90s films where a teacher from outside community comes to say, I think there was two like that. This is funny because I posted a video recently. It got like 1,500 likes and 40 something views, and I posted something else after it. I was like, let this ride the coattails, because we're talking about health here and people want to know about health. It got like 4 likes. I'm like, what is going on? The bots, can they see the actual video? Anyways, but the original song in that video was from the film that you're referencing, but it doesn't look like that. But just a side note for those of you who follow me on Instagram. That was a little secret plug. So that level of ego reminds me of 90s films where a teacher from outside community comes to save the school or at-risk youth, as though no one from that community has any level of care or confidence, right? It's the savior complex, you know, and you don't have to, like I said, you don't have to be from a different race or ethnic group to have that savior complex, right? So, you know, we all have to like measure, you know, that egoic response and what that looks like. And like I said, it's very important to, you know, really respect the people who are actually part of a given community, and learn the characteristics and what's really needed. And, you know, and when I say that, because a lot of times what happens in communities, we do public health, we do needs assessments, right? And needs assessments, they're easy because, you know, depending on what it is, you're looking at health stats, you're looking at data, and a lot of times this data is collected by the local health departments who have the funding, and capacity to do some of these things. So you can get all this information and say, okay, this is what's needed. But again, there may be people who are already doing that work, but because they don't have the resources and the access that you do coming from a big company or having funding, they don't have the capacity to have like a big, make a big noise about like what they're doing. So you have to like literally go out, like sometimes on your feet, and see what's happening, who's who in which community, right? Part of some of the work that I did when I was doing tobacco was, you have to not only make connections with the elected officials, because the ultimate goal is policy change, right? That's where public health comes in. The community health is making sure that, the community has like it's wellness. Everybody has, the access and the means to wellness. And again, this is where our social determinants of health come from. But then when you add in that public health component, that's also kind of bringing in government, right? Thinking about what funding can we have, larger government. And when I say larger, I don't necessarily mean just federal, just government in general. So it can be local, it can be state, it can be federal. What funding is coming from these places that we can use to help a specific community. And sometimes the funding is a result of legislation, which is a result of different advocacy efforts. So they all feed into one another. But yes, like, you really have to, go out and be on the ground. And so, like I was saying, like the idea of, not only having relationships with elected officials or policymakers who have that ultimate power to make the change or say like, okay, give this money, or someone who is a philanthropist and there's, different foundations, but really looking at who are the influential members of a community, because they're going to be your greatest allies and assets as well, because these are the people who have the ear of those, or ears. Oh, you have more than one. It's more than one people, more than one person. They have the ears of those who are within that geographical area. So, this is how you, get the love of the people. But again, it should also be genuine. I should say that, a lot of people, they can smell you coming a mile away if it's not genuine. I'm moving through these chats. That is called a community assessment. Absolutely. Yes. Right, there's different stats and things. Yes, it was Coolio. Yes, different stats, a community assessment. Yes, Aquia Visa says you won't give up the deets of certain organization. I think I'm not giving them up. Like I said, if you dig a little, you can figure it out, because it's not necessarily my resume is not necessarily private. But again, I'm not saying it out loud. Here even says, what you're speaking to reminds me of how important it is to have a sustainable community where all resources are available within it. Absolutely. So this goes back to what I was saying before, like, yes, what makes communities successful is like when there's a genuine invested interest, when you're involving those who live in that community. So there's not only the education, but the genuine engagement, so that they're empowered in a way so that when you're gone, there's sustainable actions that they can do on their own, right? That's that empowerment. And when you have the resources that are available. So that also means, so that's kind of akin to when we're talking about the maternal and child health. We need more doctors that look like Black women. And I'm just going to say it just like that. And so that even goes back to like, how are medical schools accepting students? What is the ratio? And not even that, how are schools, elementary schools and high schools or charter schools or whatever, how are they encouraging students to go into STEM careers? This is how you get more doctors, right, that look like you, and not having to kind of like go out of wherever it is you live to find somebody that's good, because those resources and people are resources, the human resources. So they will be resources, or even you will be a resource within your own community. That even goes back to like the reciprocity. So, and I was on my walk today. I went for, it wasn't even like a little walk. It was like 7 point something miles. I miscalculated. Fitbit was wrong. They did me dirty. When I really went back and looked at it, I was like, oh, that's why it took so long. But anyways, as I was on my walk, I was I was listening to a book, and the story was going on, and it made me think of, and I was like thinking about like today's discussion. I was like, I was reminded of Kennedy. Ask not what you can do for your country, what your country can do for you, but what you can do for your country, right? And I was like, you could just switch that to community. Ask not what your community can do for you, but what can you do for your community, right? And that's that idea of reciprocity. Not just coming into a space and like, all right, what am I going to get out of this? But what are you going to give? And that's, to your Kira Eden's point, resources being available within it. So when you're moving into a space, what is it that you're also bringing? Not thinking about like what you're getting out of it. Because let's think of even how we move. Oh, I'm going to go here because there's good schools. I got a good job, and, it's safer and da-da-da. But how are you going to maintain those things that you really like? Right? Or add to it. Even as professionals, one of the things that I thought was really smart, I heard someone say, and I made that, how I approach a given project or task. It's like, make it better than when you found it, So when you leave, it's better, and for someone else to grow it, or not, depending on who's hired. But, it makes it better. So that's really thinking about like, being a resource within the space that you're in. So Sovereign Eats says, peace, Sovereign Eats, welcome. She says, everyone is so valuable to consult those on the receiving end, and also look at the way different demographics and age group engage with what is offered and where their values lie, including, I'm going to read that again because I got a little lost. It's so valuable to consult those on the receiving end. Yeah, I don't know. I think I was just reading. It's an inside joke. It was words. Just words were happening. It's so valuable to consult those on the receiving end, and also look at the way different demographics and age groups engage with what is offered, and where their values lie, including age groups. Absolutely. And when you mention age groups, that goes into like population health, right? Where population health is really outcomes based on a specific population, because you can even have populations within a community, because that population can be seniors, right? Or youth. So there's so many organizations that have youth programs, right? Or they'll have a program for seniors, because they understand that these are different populations and groups within a community. You can, drill down to the smallest, right? Even the idea of like the, maternal and child health, like, so this is a program specifically for pregnant mothers. This is a program specifically for families. This is we're giving a diaper bank. So if you're a single person with a dog, you're not going to go to the diaper bank. That's not your ministry. That population, you're not in that population. So there's even like, segregated or separate populations within a community, and programs that are needed to just address what their needs are, or what's unmet. When Eden says, when one is foreign to a community or its needs, there's an inherent lack of connection or even understanding that can be detrimental to those you're trying to help. Absolutely. So this goes back to like, when I was like in front of the elected official, if she thought that, there wasn't any, and the truth is maybe she did think it, I thought the meeting went well, but the truth is maybe she did, because it wasn't necessarily like a connection. So we were able to meet and talk about the things that we're doing, which was really good, to get her ear. But then was there movement afterwards? Not necessarily. So it may not have been bad in a place where I was able to say we involved the community, but it wasn't necessarily good, because there's this idea like, well, you're not really here to help, right? How are you helping? How has that helped anyone? Even if people were involved, like have you helped? So it can be seen as detrimental, to individuals. Now the task that was being promoted, it was actually like a mandate from the federal government. So it wasn't like something we came up with and was like, okay, it's like, well, how can we, at least give people an outlet to say what they're thinking, right? But yes, it can be detrimental, because you don't necessarily know. So then you might embark on I'm going to do, let's go back to like the diabetes example. I'm gonna we're gonna get a place to give coupons to this particular supermarket, so that people can buy, like, this healthy food, right? So here are like some inherent problems in that. Can people actually get to this supermarket, right? Like, for the population that you're serving, is transportation, available? And even that, like, something as simple as transportation. Like, and I'll say, like, even in a large city like New York City, this I'll say, like New York City, that has like one of the most complex transit systems in the world. There are areas in boroughs that are transportation deserts where you cannot get to or from unless it's a bus or an automobile. Like, the trains don't necessarily go that far, and even in some cases, you're dependent on the start and end times of the bus route. So, and if you don't have a car, that's an issue. Yeah, there's Uber and all that, but those things cost money. So you have to really think, like, well, can people get there? So New York City does have in place, like, the farmers markets and things like that. But even like, I remember, like, during the pandemic, it wasn't necessarily the easiest things. People had like health bucks in surplus because they weren't able to necessarily get to the farmers markets that were open. So, like, these are, an issue. So we're talking about like nutrition and reducing certain things. Like, you have to kind of think through some of those things. Another example of, how, the lack of connection or understanding could, be detrimental. Like, using the same example is, so you have like the transportation issue. Okay, well, what happens when, the store can no longer afford to do, because you pick this like great supermarket. What happens when the store can no longer afford to provide like these coupons to so many people, if they're able to even get there, right? So it's not sustainable. So you really didn't look into anything sustainable. And those are just like small examples. And please feel free to, like, give examples or share stories where you've had a successful or maybe not so successful intervention or initiative with the community. Shalom, Ramik. Shalom, shalom, shalom. So that's what I wanted to say. I'm going to check really quick on LinkedIn because, like I said, I don't think I'm seeing the comments on LinkedIn. But I don't think there are any. But I really thank all of you for coming. I just wanted to have this like really quickly. No, there are no comments on LinkedIn. Okay, but give thanks for all of you who have joined. And but I just wanted to share that, like, the importance of, public health initiatives in community health, and share different ways in which they, have worked or can work, and really think about like community, right? Because we like to throw around words like a lot. And community, I won't say it means something different. Well, it can mean something different for different people, right? It can mean something different for different people. It's not just, the place where you live. Because like I said, you can live in a place and not even know your neighbor. But you're lumped in as like being part of this community because you share a geographic space. You share a common space. But you necessarily don't, share much other than that. So when we're thinking of initiatives and interventions, as individuals, we should really think about the communities that we're in and whether we share like the culture and attitudes, because then when we have interventions that are needed, those resources can actually come from within and not have to rely on outside sources. Don't get me wrong, like I said, bring on the money. But if you are, within your space and you make it even like insular, your doctors come from the same community. So you have that, you have like your accountants, you have that, and you have, your advocates like me, you have that. So we're all coming from the same space. That means we're moving at the same tempo. We're moving in the same direction. So when we think about community health, let's think about like trying to get it into that mode where the community actually is the origin point of having some of these public health initiatives, and they're not necessarily coming from the outside, because then that also makes things be able to move quicker, right? Because you already have your program coordinators, your people who are going to know like how something needs to be implemented. You already have your program managers. You have, the operational specialists. You have all those people within that area, and you're not waiting on an organization that got some money to like hire up people to start it a year after they got the grant. I'm just saying. So I give thanks for everyone who came into the space. Make sure you like, share, subscribe. A few housekeeping rules before we leave. I also work with Untitled Life Global Ministries, and we do have Red Wrap. Red Wrap is focusing on menstrual health and hygiene education and products, giving them to unsheltered women and girls. We've also moved into working with schools and community groups in underserved areas. So this coming in a few weeks, November 3rd, we'll be working with East Flatbush Village, which is an organization, a nonprofit that works with at-risk youth in communities, and we'll be facilitating a workshop with young girls. So donations of menstrual hygiene products are always appreciated. We gladly receive them. You can send them to the East Flatbush Village at between October 3rd to October 31st. That's when we'll be collecting the donations. And you can send them to East Flatbush Village, attention Ron London, at 1011 Utica Avenue, Brooklyn, New York, 11203. Again, that's 1011 Utica Avenue, Brooklyn, New York, 11203. Also, some housekeeping rules. We are also, I'm also involved in Untitled Life Global Ministries Womb Room. So we will be having, actually coming up after this, our Anu Womb initiative, our Anu Womb ministry is having Menstruation the Righteous Way. So we're talking about menstruation, and that's going to be premiered this evening at 8:30. So in about 40 minutes. Please join us on YouTube, on Anu Life Global Ministries channel, YouTube. It'll be premiering. We'll be answering questions live. The chat will be live, so everyone should join. If you have questions, episode 1 is this week, and episode 2 is next week. Can I put the address in the description? Yes, I will. So I will put the address in the description on YouTube and Facebook for the donations. Also, if you have questions about donations, kind of rewinding. If you have questions about Red Wrap, you can visit www.anulifeglobal.org/redwrap, and you can email redwrap@anulifeglobal.org. Again, you can email redwrap@anulifeglobal.org. And it gives all the instructions of the types of products needed. We're actually making special packages for these girls because they're actually going to be mainly under the age of 13. So this is really a talk about menarche. Menarche is the beginning of the menses for girls who are becoming women. So they actually don't get like the regular Red Wrap bag. They get what we call our Red Wrap Blossom Box, which will be filled with all these little goodies for a young girl who's first starting her period. So we want panties, panty liners, pads, Tide sticks are helpful, or any kind of detergent stick, deodorant, body wash. You can make them travel size or full size, whatever your heart's desire. And we're going to be making these blossom boxes for these young girls for something that they can enjoy when they have their first period. So we talked about the Red Wrap. We talked about the menstruation premiere, Menstruation the Righteous Way, coming up. We're really going to be talking about menstruation and scripture, how it's viewed in scripture. What is clean, what is unclean. So join us there on Untitled Life Global's channel. And I think that's all the housekeeping rules. Oh, more housekeeping. Make sure you rate the podcast. So this is not only a live show. True Health Live is also a podcast that's broadcast on many different platforms. We're on Spotify, we're on Apple Podcasts, we're on Google Podcasts, we're on Pandora, we're on Stitcher, and something else. So make sure you go and put a review in. And again, I look at everything, so I'll definitely be looking at it. And we will always accept suggestions if there's something that you really want to talk about. If you're a public health professional that wants to just come on and share your 2 cents or more, we're definitely open to interviews and having guest co-hosts. So Akuya Bisa says, thank you. I'm learning the importance of public and community health by way of your organization. Give thanks. Naya, thank you. Oh, good. Also, if you haven't, right, links over to Spotify. Make sure you go back and check some of our previous shows. There's a lot of gems being dropped, especially like last month's show. We had Wikimedian on. I learned what a Wikimedian was. Like, so the point of True Health Live is to talk about the truth, true topics in public health. And sometimes that means, uncomfortable things, but also making sure that we walk away with something that we learned that we may not have known before. So thank you, everyone. Give thanks. Yes, thank you for the build. And we will see you next time. I don't know if that's going to be in 2 weeks or next month, but we'll see you next time. Peace, everyone.